I'd like to talk about alcohol and mental health, the impact of alcohol on mental health. I'd like to talk about alcohol and within grief. Okay, but first of all, I'd like to introduce myself. I'm Ghazala at the Heart and Soul Cafe. If you've been here before, thank you so much for coming back. And if you're here for the first time, you're very, very welcome. All right, so let's talk about alcohol and alcohol within grief. All right. When we talk about alcohol misuse, we're actually saying that we're using these substances, alcohol and drugs, let's say, at a level where it is harmful to our bodies. Okay, so that's really where we're differentiating between, someone who's a weekend user to somebody who is misusing drugs and alcohol. All right, so there. Just wanted to get that clear on the onset. So there are four main categories of drugs. Let's just go through these, but I really do want to focus in on alcohol within this video. So the first one is stimulants, and stimulants covers things like cocaine and ecstasy. All right. And the second one, you've got depressants. Okay. So remember that these are depressants, and that includes things like alcohol and cannabis. All right. Then we've got opiates, which covers things like heroin and codeine. And then there's hallucinogens, which are your LSDs and things like magic mushrooms and things like that. Okay. So, but we are going to, as I say, look at alcohol. And the reason why we're looking at alcohol is that alcohol is used very widely as a way of self-medicating. Okay, self-medicating. When pain is, almost unbearable, let's say, and that might be due to a mental health condition, okay, such as depression, and other mental health conditions, and also things like grief. Now, grief isn't a mental health condition, but the pain can be to an extent where someone feels that they would like to numb that pain. They want to numb that pain with something like alcohol, right? And remember when I said alcohol is a depressant? Well, it actually is. It can momentarily lift someone's mood and elevate someone's mood, for a short space of time. But in the long run, it's actually a depressant, and it's going to bring the person down, possibly down further than they were when they started off using that particular, drug, which is alcohol. So it can have the complete, opposite result of what that person was after in the first place. All right, so it can do that. So let's talk about the effects of alcohol on somebody's body. Well, it can impair someone's judgment. Okay, so that person can feel confused in how. So things that they maybe would be able to do otherwise when they're not under the influence of alcohol, and their sort of their skill of, let's say, judgment is affected by the influence of alcohol in their system. Okay, so there's that. There's mood swings. So that person may feel quite elated at one minute, and possibly, soon after feel quite low. And that's something that's going to happen with alcohol anyway, because it can bring you up and then, bring you very, very low in the next, hour or so. So it can do that. Mood swings, and that can make people irritable. It can make people short-tempered, perhaps, or tearful, perhaps, or you kind of feelings of overwhelm. So there's all sorts of moods that that might manifest as a result of using alcohol there. All right, anxiety. It might make the person more anxious, and also anxiety and depression go pretty much hand in hand most of the time, not all the time. But I've also mentioned already that it's a depressant, so it can lead to depression. So anxiety and depression can be something that can, be the side effects of alcohol in itself. The person may become paranoid, so you may think that people around you are not sort of with you, they're against you perhaps, and that might make you feel quite uncomfortable, or people are talking about you, or they're not really your friends. Possibly. I'm just sort of trying to make some sense of, trying to clarify when I'm saying paranoia. So you might feel that you're being followed. You might feel all sorts of things. You might expect it might show up in all sorts of ways. Confusion. So you may not, see reality in the way that you normally would, if you weren't under the influence of alcohol. Your memory might be affected. So your short-term memory or your long-term memory might be affected as a result of using alcohol. And you might have an altered perception of reality. So you're not being able to differentiate between what's real and what's not real, and that might be a problem in itself. It can lead to things like, illness of the, to heart disease or liver disease, perhaps, or even cancers. And the other thing that is, that we must mention is that, someone may become dependent on alcohol. And then from that dependency, it could actually become an addiction. Okay. So, the more someone is relying on it or depending on it, the more chances of actually becoming, dependent on that and addicted to that, to that particular drug. And how can it affect someone's life? Well, if it's affecting those things, personally, it is going to affect your life, isn't it? So it can actually affect your functioning. So you're not functioning in a way that you normally would, which is normal to you, not normal as in comparison to somebody else. So you're not getting things done that you need to get done in your day-to-day life, perhaps. And that might lead to all sorts of things, getting to work late, perhaps, or, because you can't quite get it together, or you're not going into work at all some days and sort of taking more time off. That might lead to, disciplinary action from your organization, perhaps, or even losing your job altogether. That then would have a bigger impact on your life, wouldn't it? So if you actually lost your job. It can also, because if it's impacting on your life and on your health, it can impact on your relationships. So, marriage breakdowns and separation or even divorce, could happen. And again, if you've lost your job, and it could lead to, financial hardship, and that could lead to all sorts of things. It could lead to, homelessness. Which probably would be the bottom line, but yes, it could lead to that. So there's all sorts of things that, alcohol misuse, alcohol dependency, alcohol addiction could lead to. All right. So this video is all about just raising awareness about alcohol. And if we talk about what's the limit, let's say, of alcohol that well, in the UK, it's NHS. So what does the NHS say per unit, per week, that you should not be exceeding? Yeah. So it's actually 14 units for men and 14 units for women. What does 14 units look like? Well, 14 units in let's say, glasses of wine is about 6 glasses, which is 175 ml glass, which is a medium glass if you went into a pub, let's say. So 175 ml times 6. If we're talking about beers, it's around about 6 beers as well, which is, can't remember the amount of alcohol. Yeah, it's gone out of my head, but around about 6 glasses of 6 pints of beer as well. Now, that amount of those 14 units shouldn't be saved up for, Friday night and then you binge drink the whole 14 units in one sitting. It should be spread over the week, at least over 3 to 4 days, should be spread across that, not taken all in one go. That's not advisable, for obvious reasons. All right. So yes, people do use alcohol to self-medicate. I think if alcohol is used on as a social thing, it can be sort of seen as quite healthy, and it's acceptable in most societies and a lot of societies. So that's okay, but it's when people become dependent on it and when people become addicted to it, and people use it as a turn to mask and numb pain. That's when it can become problematic there. Yeah? Okay. So thank you. If you did find any content of this video useful, please do share it. Please comment, please like, please subscribe, because again, we're trying to build this community and trying to make a platform here where we can have discussions about mental health, about grief, about bereavement. So please do subscribe. And otherwise, I look forward to seeing you in the next video. Yeah, until then, take care of your hearts and souls. Thank you.